Hi all, welcome to another video of NS Pharma. In today's video, we will see Pharmacist previous year question paper along with its explanation. This is MP Vyapam Group 5 Pharmacist question paper. This is the fourth part of the same question paper. We already covered 20 questions in 3 parts. In this video, we will try to cover 55 questions more. That is, we will complete the question paper in this video. So, we will move to the first question of this video. Question number 21. Which of the following poisoning can cause mydriasis? Which of the following poisoning can cause mydriasis? Options are nicotine, phenytoin, organophosphates, datura. The correct answer for this question is datura. So, what is mydriasis? Mydriasis is the dilation of the pupil of eye, dilation of the pupil. Then another term is miosis. Miosis is just opposite to the mydriasis, that is constriction of the pupil. Why datura causes mydriasis? Because datura contain atropine as a chemical constituent. When we are studying datura in the chemical constituent, we can see that is atropine is present. So, atropine is normally causes mydriasis. So, datura poisoning will make mydriasis. We will move to the next question, question number 22. Who was the first person to identify kwashiorkor? Who was the first person to identify the kwashiorkor? Kwashiorkor is a disease. It's a protein deficiency disorder. Protein deficiency disorder is the kwashiorkor. Another disorder is there, that is marasmus. It's very confusing in between. Marasmus is actually, it's an energy deficiency disorder. Energy deficiency disorder, but kwashiorkor is specially protein deficient disorder. So, here the question is, who was the first person to identify kwashiorkor? Options are Dr. Adam Maxwell, Dr. Gerald Kwashiorkor, Dr. Cecily Williams, Dr. William Weintraub. The correct answer for this question is Dr. Cecily Williams. Dr. Cecily Williams is who was the first person who identified the kwashiorkor. Dr. Cecily Williams. Next question, question number 23. Which among this is not an empirical color reaction for steroid? Which among this is not an empirical color reaction for the steroid? Options are Salcoxy reaction, Lieberman-Burchard, Rosenheim reaction, Benedict's test. So, the question is, which is not related to steroid test? Options Salcoxy, Lieberman-Burchard, Rosenheim reaction, Benedict's test. The correct answer is Benedict's test. Option 4 is the correct answer. Which of the following is not an empirical color reaction, that is color reaction of steroid? Benedict test is the correct answer. Benedict test is actually used for the identification of reducing sugars, that is carbohydrate, reducing sugars. Now, we will move to the next question, question number 24. What type of fever appears in malaria patients? What type of fever appears in malaria patients? Options are intermittent fever, relapsing fever, continuous fever, remittent fever. The correct answer is intermittent fever. Option 1, intermittent fever is the correct answer. In case of malaria patient, what type of fever is appear? Intermittent fever. That is, temperature will be elevated for several hours. After that, the individual means the temperature will fall into the normal level. That means for several hours it will be elevated. After that, for some hours it will be in the normal, like that. So, that is the intermittent fever. That is the fever appear in malaria patient. Next question, question number 25. Which among the following is used for the physiological control of pH? Physiological control of pH, that is related to the antacid. So options are iron 3, alum, hydrogen peroxide, then magnesium trisilicate oral suspension. We know that magnesium trisilicate oral suspension can be used as antacid. The correct answer for this question is option 4, magnesium trisilicate oral suspension. We are moving to the next question, question number 26. What is the adult dose of doxycycline in the treatment of cholera? What is the adult dose of doxycycline in the treatment of cholera? Doxycycline is a tetracycline. So here options are 350 milligram, 250 milligram, 300 milligram and 200 milligram. The correct answer is 300 milligram. In case of cholera treatment, doxycycline adult dose is 300 milligram. Question number 27. Contraindicated drugs are the examples of options are therapeutic incompatibility, chemical incompatibility and physical incompatibility. Option 4, physical incompatibility. The correct answer for this question is therapeutic incompatibility. That is, contraindicated drugs are the examples of therapeutic incompatibility. Question number 28. Which of the following formulations would be considered as an oropharyngeal formulation? The formulation which is considered as an oropharyngeal formulation, that is used for the infection, for the treatment of the infections in the case of oropharynx or in the site of oropharynx. Options are Linctus, mouthwash, elixir, syrup. The correct answer is mouthwash. Mouthwash, we can use it for the infection on oropharynx. Next question, question number 29. If a rectal suppository is used to treat a fever, it would represent what type of drug delivery? Options are enteral and local, parenteral and local, parenteral and systemic, enteral and systemic. The question is based on the rectal route is coming under which category of drug delivery system. The correct answer for this question is enteral and systemic. Enteral and systemic. What is parenteral route? Parenteral route, in parenteral route, drugs are administered in the body other than mouth and alimentary canal. Other than through the mouth and alimentary canal, that is injections and all these things are coming under parenteral route of administrations. But in case of enteral, that is the drugs are administered through mouth and alimentary canal. So here it is, rectal route is a part of alimentary canal, so it is an enteral route, and through that drugs is absorbed into the blood circulation, so it is a systemic. So it is the question answer is enteral and systemic. Question number 30. Which of the following snake has hemotoxic venom? Hemotoxic venom, that is, it will act on heart and cardiovascular system, that is hemotoxic. The options are Russell viper, krait, rat snake, cobra. The correct answer for this question is viper, that is Russell viper. All the type of vipers they have hemotoxic venom. Other type of venoms are proteolytic venom, then neurotoxic venom is there, then cytotoxic venom is also there, but the viper have hemotoxic venom. Question number 31. What is the role of misoprostol? What is the role of misoprostol? Options are, it is helpful in preventing ulcers induced by NSAID. Option 2, can cause constipation. Option 3, does not inhibit acid secretion. Option 4, can delay labor in pregnant woman. The correct answer for this question, misoprostol is helpful in preventing ulcers induced by NSAID. That is option number 1 is the correct answer. When we are studying peptic ulcer, drugs used for the peptic ulcer in the pharmacology, this misoprostol is coming under that category. Misoprostol is a prostaglandin analog, gastric acid secretion inhibitor. It is a prostaglandin analog, gastric acid secretion inhibitor. Question number 32. Which of the following is a plasminogen activator? Which of the following is a plasminogen activator? What is plasminogen activator? They can dissolve the clot. So, suppose there is a clot inside the blood vessel or in the heart. If plasminogen activators are given through the into the body, then they can dissolve the clot and save the patient. So, that is the plasminogen activator. Here the options are donepezil, tranexamic acid, streptokinase, aminocaproic acid. The correct answer is streptokinase. Streptokinase is a plasminogen activator. Donepezil, we know that is used for the treatment of Alzheimer's disease. Donepezil is used in Alzheimer's disease. Tranexamic acid it prevents excessive blood loss. It helps to clot. It helps in clotting and also it prevents the excessive blood loss. Then last, aminocaproic acid. It is also used in the treatment of acute bleeding, especially due to fibrinolytic activity. Tranexamic acid and aminocaproic acid, they are different. Tranexamic acid is used to prevent the excessive blood loss. But in case of aminocaproic acid, it is used for the treatment of acute bleeding due to elevated fibrinolytic activity. So aminocaproic acid is used for the acute bleeding. Now next question number 33. Hydroxocobalamin is used as an antidote for. Hydroxocobalamin is used as an antidote for. Options are cyanide, botulism, mercury, opiate. Hydroxocobalamin is a vitamin B12 variant. It is also a complexation agent. Hydroxocobalamin, cobalamin, it's their cobalamin, that is vitamin B12 variant, and it is a complexation agent. So it is active. It will bind with cyanide ion and form cyanocobalamin, which is a non-toxic. So cyanide is a poisonous agent. So cyanide, when hydroxocobalamin is given to cyanide poison person, it will bind with the cyanide and make the complex of cyanocobalamin. So it is used as an antidote for cyanide poisoning. Next question 34. Calculate the dose of a child who has a body surface area of 0.57 meter square and the adult dose of a drug is 100 milligram. So here the question is regarding the calculation, that is we have to calculate the dose of pediatric dose, the dose of a child. They are given body surface area of the child and also adult dose. For finding this one, we have an equation, that is child dose is equal to child body surface area into adult dose divided by 1.7. That is child dose is equal to child body surface area into adult dose divided by 1.7. That is 0.57 into adult dose is 100 divided by 1.7. 0.57 into 100 divided by 1.7. That will be approximately 33 milligram. So the correct answer is option 1. Option 1 is the correct answer. In question number 35, in a drug nomenclature, the stem tricin is used for anti-migraine agent, antidepressants, atropine derivatives, antibiotic. The correct answer is antibiotic. You know, bacitracin, tricin is coming under this category. So this is antibiotic. Question number 36. Which among these are used as a respiratory stimulant? Which among these is used as respiratory stimulant? Option: carbon dioxide with 5 to 7% of oxygen, nitrogen with 5 to 7% of oxygen, helium with 5 to 7% of oxygen, carbon monoxide with 5 to 7% of oxygen. We know that carbon dioxide is a respiratory stimulant. So here the answer for this question is option 1, carbon dioxide with 5 to 7% of oxygen. Now we are moving to the 37th question. Licorice, ipecacuanha and Wasaka possess similar pharmacological effect to that of. Options are bronchodilator, antitussive, expectorant, laxative. Licorice, ipecacuanha and Wasaka, they have similar effect of. The correct answer for this question is expectorant. They are used as expectorant. Question number 38. What is the molecular weight of papain? What is the molecular weight of papain? Options are 28,000 Dalton, 23,000 Dalton, 21,000 Dalton, 26,000 Dalton. The correct answer for this question is 23,000 Dalton. That is option 2 is the correct answer. That is the molecular weight of papain is 23,000 Dalton. Since we have to cover 55 questions almost in this video, that's why I am making little bit speed. So if you are finding any difficult to follow me, you can pause the video and rewind. You can learn each question. After that you can move into the next question. So we are moving to the next question, question number 39. Which among these is a precipitating germicide? Which among these is a precipitating germicides? Options are hydrogen peroxide, silver nitrate, sodium hypochlorite, hypochlorous acid. The correct answer for this question, since it is there is a precipitation, so the silver nitrate is always working on the principle of precipitation. So here the answer is silver nitrate. The other things, that is hydrogen peroxide, sodium hypochlorite, hypochlorous acid, all are working on the principle of oxidation. Next question, question number 40. Thromboxane A2 is released mainly by. Thromboxane A2 is released mainly by. Options are T lymphocyte, liver, muscles and platelets. The correct answer for this question is platelets. Platelets are the correct answer. Thromboxane A2 is released mainly by platelets. Question number 41. Coca, opium and hemp come under which act? Coca, opium and hemp come under which act? Options are Insecticide Act, Poisonous Act, Narcotic and Psychotropic Substance Act, Spurious Drug Act. We know that these drugs given in this question are coming under Narcotropic and Psychotropic Substance Act. The correct answer is option 3. Question number 42. Which among the following is a strongest acid? Which among the following is a strongest acid? Amide, imide, sulfonamide, sulfonimide. The question is the strongest acid. The correct answer is sulfonimide. Option 4. Sulfonimide is the correct answer. Question number 43. Injections are generally sterilized by. Injections are generally sterilized by. These questions came from pharmaceutics. Options are dry heat method, moist heat sterilization, tyndallization method, pasteurization method. The correct answer for this question is injections are generally sterilized by moist heat sterilization. Option 2 is the correct answer. Pasteurization method, we know that it's used for the sterilization of milk. Question number 44. Airtight containers are used for liquid preparations, capsules, injectable products, tablets. The correct answer for this question is injectable drugs. Option 3 is the correct answer. Question number 45. Buffer is a solution of. Option 1, strong acid and its conjugate base, strong base and its conjugate acid, strong acid and strong base, weak acid and its conjugate base. The correct answer, buffer is a solution of weak acid and its conjugate base. That is option 4 is the correct answer. Question number 46. The most common childhood malignancy is known as. The most common childhood malignancy, that is the childhood cancer, the most common type. Options are acute myeloblastic leukemia, acute lymphoblastic leukemia, a chronic myelocytic leukemia, chronic lymphocytic leukemia. The correct answer is option 2, that is ALL, acute lymphoblastic leukemia is the correct answer. That is the most common childhood malignancy. This is a acute lymphoblastic leukemia. That is a cancer characterized by the development of large number of immature lymphocytes. There will be large number of immature lymphocytes. Question number 47. Digitalis leaves are commonly adulterated with. Digitalis leaves are commercially adulterated by. Options are lavender leaf, datura leaf, London pride leaf, comfrey leaves. The correct answer is option 4, comfrey leaves. This is an important multiple choice question. So, important question. So, this question is already came in different pharmacist exams. So, you have to by heart this one. Comfrey leaves is an adulterant of digitalis leaves. Question number 48. The glandular trichome. The glandular trichome which contains active phytoconstituents of the plant is. Trichomes we already covered in the first, I think in the first part, what are the trichomes. So, here the question is glandular trichome which contain active phytoconstituent of the plant is. Options belladonna, cannabis, datura, ergot. The correct answer is cannabis. The cannabis is the correct answer. So, cannabis contain glandular trichome. Nux vomica contain lignified trichomes. Nux vomica contain lignified trichomes. Question number 49. Site of action of ADH. Site of action of ADH, that is antidiuretic hormone, that is vasopressin. Site of action of ADH is. Options are proximal tubule, ascending loop of Henle, descending loop of Henle, collecting duct. ADH will act on collecting duct. The correct answer is option 4. Question number 50. Antimuscarinic agent preferred. Antimuscarinic agent preferred in the management of motion sickness. Antimuscarinic agent preferred in the management of motion sickness is. Options are atropine methonitrate, scopolamine, homatropine, methyl bromide, ipratropium bromide. The correct answer is option 2. Scopolamine is the correct answer, which is used in the management of motion sickness. Question number 51. Liquid which decompose at or below their boiling point are purified by. Liquids which decompose at or below their boiling point are purified by. Options are fractional distillation, destructive distillation, steam distillation, distillation under reduced pressure. The correct answer for this question is steam distillation. Option 3 is the correct answer. Liquids which decompose at or below their boiling points are purified by steam distillation. Question number 52. If the iodides are used in the solution as expectorants, it is protected by sodium thiosulfate, which acts as oxidizing agent, neutralizing agent, acidifiers, antioxidant. So, the question is, if the iodides are used in the solution as expectorant, it is protected by sodium thiosulfate, which acts as. So, the question is, sodium thiosulfate is acting as. Correct answer is antioxidant. Sodium thiosulfate is a antioxidant. Next question, question number 53. Development of brownish color and then it changes to green occur when nitric acid is applied either directly to the powder or to the solution of alloys of the variety is used for the preparation of. So, it is asked for the alloy variety. We know that alloys have different varieties like alloy barbadensis, alloy spicata, alloy perre, like that. Alloys are of different species. The question, which variety will develop brownish color and then it changes to green when it is treated with nitric acid. Options are Cape alloy, Kurakova alloy, Socotrine alloy. Option 4, Zanzibar alloy. The correct answer for this question is Cape alloy. Cape alloy is the correct answer. So we will study each one. Barbados alloy. Cape alloy we already know. The second option, Curaçao alloy or Barbados alloy, which will form deep brownish color when it is treated with nitric acid. The second option, Curaçao alloy, or it is also known as Barbados alloy, which when treated with nitric acid it will form deep brownish color. Cape alloy we already discussed in this question itself. The third one, Socotrine alloy, will form pale brown to yellow color when it is treated with nitric acid. That is, Socotrine alloy will form pale brown to yellow color. Last option, Zanzibar alloy, which will form yellowish brown color when it is treated with nitric acid. These are the different colors formed by different alloy varieties when it is treated with nitric acid. Question number 54, biological and biotechnological products are included in options are Schedule A, Schedule B, Schedule X, Schedule C and Schedule C1. We know that Schedule A is related to application form, Schedule B is related to application fees, Schedule X is related to narcotic and psychotropic substance. The last option, biological drugs, are coming under Schedule C and C1. The correct answer here is Schedule C and C1. This one we already discussed in detail in the part 2 of the same question paper. Next question, question number 55. Drug of choice for the organophosphorus poisoning. Drug of choice for the organophosphorus poisoning. Options are neostigmine, atropine, physostigmine, acetylcholine. The correct answer is atropine. Atropine is the correct answer. Next question, question number 56. Plaster of Paris is used for the temporary support in broken bone. Which is a plaster of Paris is CaSO4 half H2O, CaSO4 2H2O, CaSO4 5H2O, CaSO4 7H2O. Here it is mentioned, or anyway it is calcium sulfate, but the water content, that is the difference. So here the correct answer for this question is plaster of Paris is CaSO4 half H2O. The question option 1 is the correct answer. The second option, that is CaSO4 2H2O, is gypsum. Gypsum. Next question, question number 57. Which formulation is not suitable for ocular administration, that is for administration to the eye? Which of the formulation is not suitable to the ocular administration? Options are ointment, suspension, liniment, solution. The correct answer is liniment. Liniment we know that this one should apply by the rubbing. We have to rub it on the surface of the skin. So it's not possible to use inside the eye. Next question, question number 58. VDRL. VDRL is used for the diagnosis of, the correct answer, the options are hepatitis, syphilis, typhoid, cholera. The correct answer for this question is syphilis. Syphilis is the correct answer. VDRL is used for the diagnosis of syphilis. So what is VDRL? V represent venereal, D represent disease, R represent research, L represent laboratory. That is VDRL test is venereal disease research laboratory test. Another one is, important one is Mantoux test, that is we know that which is used for the diagnosis of tuberculosis, TB, Mantoux test. Question number 59. COC pill. COC pills are not recommended for women feeding the babies because, what is COC pills? COC pills are combination birth control pills. Combination birth control pills, that is they are the oral contraceptives containing estrogen and progestin. So estrogen is also there, progestin is also there in COC pills. So it is not suitable for the feeding woman. Why? Options are, it may affect the baby's growth. Option 2, it may affect the quality and quantity of the secreted milk. Option 3, it may cause stroke in the babies. Option 4, it may cause blood clot in veins. Correct answer is option 2. It may affect quality and quantity of the secreted milk. Question number 60. Full form of LSD. LSD. Options are lysergic acid dimethylamide, lysinic acid diester, lysergic acid diester, lysergic acid diethylamide. The correct answer is lysergic acid diethylamide. This one we had noted down, option number 1 and option number 4. There will be confusion. You have to by heart this one, lysergic acid diethylamide, not dimethylamide. Okay. Question number 61. The Constitution of Pharmacy. The Constitution of Pharmacy Council of India, that is PCI, takes place at every. The Constitution is taking place of Constitution of PCI is taking place at every. Options are 4 years, 6 years, 5 years, 3 years. The correct answer is 5 years. Question number 62. Chemical name of ephedrine. What is the chemical name of ephedrine? Here in the question itself they have given the chemical formula, but the question is chemical name. Options are erythro beta methylamino ethyl benzyl alcohol, erythro alpha methylamino methyl benzyl alcohol, erythro beta methylamino methyl benzyl alcohol, erythro alpha methylamino ethyl benzyl alcohol. The correct answer is erythro alpha. You have not done erythro alpha methylamino ethyl benzyl alcohol. Okay. Correct answer is option 4, erythro alpha methylamino ethyl benzyl alcohol. That is the ephedrine chemical name. Question number 63. Diaryl heptanoid is a chemical constituent. Diaryl heptanoid is a chemical constituent of turmeric. This constituent is known as curcumin, curcuminoid, DL, R, termeron, dimethoxycurcumin. In the question itself, you had to note it down. Diaryl heptanoid. Here it is. Noid is there. Noid. So the question options you can see curcuminoid. Oid is there. So you had to opt for curcuminoid. The correct answer is curcuminoid. Question number 64. Rabies is caused by. Rabies is caused by. Options are Lissa virus type 3, Lissa virus type 4, Lissa virus type 2, Lissa virus type 1. The correct answer is option 4, type 1 Lissa virus. Rabies is caused by type 1 Lissa virus. Question number 65. Wool sweat or swin consists mainly of. Wool sweat or swin consists mainly of potassium salt of fatty acid, potassium salt of stearic acid, sodium salt of stearic acid, sodium salt of fatty acid. The correct answer is potassium salt of fatty acid. Potassium salt of fatty acid. The option number 1. Wool sweat or swint consists mainly of potassium salt of fatty acid. Question number 66. The trial, that is a clinical trial, it is so planned that the participant is not aware whether he belongs to the study group or control group. The trial which is so planned that participant is not aware whether he belongs to study group or control group, which is called double blind trial, single blind trial, triple blind trial, control blind trial. The correct answer is single blind trial. In this case, participant is not aware about this case, so it is single blind. Suppose participant as well as the experimenter, that is who is taking care of experiment, or the participant, both of them don't know in which category they belong, the participant is belongs to, then that trial is known as double blinded trial. In triple blinded, neither the participant nor the experimenter, even nor the evaluator knows the who is receiving particular treatment. That is the triple blind. 3 persons, that is participant, experimenter and evaluator, they don't know who is taking the real drug and who is taking control drug. That is the triple blind. Question number 67. Antibodies which make the bacteria more susceptible to phagocytosis are called. Antibodies which make the bacteria more susceptible to phagocytosis are called. Options are agglutinin, precipitin, opsonin, bacteriolysin. The correct answer is opsonin. Option 3, opsonin. Question number 68. Angiotensinogen is produced by. Angiotensinogen is produced by. Options are kidney, liver, muscle, spleen. Angiotensinogen is produced by. Correct answer is liver. Option 2, liver is the correct answer. Angiotensinogen. We know that angiotensinogen is converted into angiotensin 1 by the action of renin, which is produced from kidney. Renin is produced from kidney, but angiotensinogen is produced from liver. So, once angiotensinogen is converted into angiotensin 1, which is again converted into angiotensin 2 by angiotensin converting enzyme, this angiotensin 2 will increase the blood pressure. It will increase the blood pressure, angiotensin 2. So, we have a mechanism of some drug, they are acting on the angiotensin converting enzyme inhibition, ACE inhibitors. We studied in this in the pharmacology, ACE inhibitors. So, we are moving to the next question, question number 69. Corpus luteum is maintained by. Corpus luteum is maintained by. Corpus luteum, we know that this is responsible for the production of progesterone hormone, especially during the early pregnancy. In the early pregnancy, pregnant stage, corpus luteum is responsible for the production of progesterone. This is maintained by. Options are FSH, follicle stimulating hormone, estrogen, HCG, human chorionic gonadotropin, then option 4, oxytocin. The correct answer is HCG. HCG. Question number 70. Vomiting should not be induced in the treatment of. Vomiting should not be induced in the treatment of. Options are warfarin poisoning, poisoning with corrosives, atropine poisoning, paracetamol poisoning. The correct answer is vomiting should not be induced in the treatment of poisoning with corrosive. That is option 2 is the correct answer. 71. The trachoma, we know that it is an infection of eye that will cause blindness. That is the trachoma control program in India was launched in which year? The question is based on the year. The program, that is trachoma control program in India, is launched in which year? Options are 1973, 1968, 1954, 1963. Correct answer is option 4, 1963. Question number 72. The main adverse effect of salbutamol are. The main adverse effects of salbutamol are. Options are bradycardia and heart block, nausea and vomiting, diarrhea and hypotension, palpitation and muscle tremors. The correct answer for this one, salbutamol adverse effect is palpitation and muscle tremors. Option 4 is the correct answer. Question number 73. Tulasi belongs to the family of. Tulasi belongs to the family of. Options are Labiatae, Lauraceae, Liliaceae, Loganiaceae. The correct answer is Tulasi is coming under Labiatae family. Tulasi is coming under Labiatae family. Tulasi is also known as holy basil or sacred basil. The synonyms are holy basil, sacred basil. The biological source is leaves of Ocimum sanctum. Ocimum sanctum belongs to the family Labiatae. The next question we are going to 74. In mammary glands, milk secretion occurs due to. In mammary gland, milk secretion occurs due to. Options are estrogen, progesterone, prolactin, oxytocin. The correct answer is prolactin. Prolactin causes milk secretion in mammary gland. Prolactin is secreted by anterior pituitary gland. Question number 75 and the last question of the video. A detailed study on digitalis was carried out by the scientist. A detailed study on digitalis was carried out by the scientist. Options are A. W. Eichler, Stas Otto, William Withering, Johann Schmitz. A detailed study on digitalis was carried out by the scientist. The correct answer is William Withering. William Withering is the correct answer. So, these are the questions came on the MP Vyapam 2017 question paper, pharmacist question paper. We already discussed these 75 questions. If you have any doubt regarding this question, you can ask on the comment section. I hope you like this video, and if you like this and if you want to get more videos regarding the pharmacist questions and also the job opportunity of the pharmacist, you can subscribe my channel by clicking the subscription button, and also press the bell button so that you will get the notification whenever I upload new videos. Thank you for watching my video. Thank you.